What if I told you that the vitamins sitting in your kitchen right now could silently increase your risk of a life-altering stroke, a fatal brain bleed, or permanent nerve damage? Yes, the very pills millions take every day to stay healthy might be quietly harming their bodies. Especially if you are over 60, this is not fear-mongering. Today, I am exposing the hidden dangers behind common supplements. By the end of this report, you will view your supplement cabinet in a completely different light. It begins with something as seemingly innocuous as vitamin D. For years, we have heard that vitamin D is essential for strong bones, robust immunity, and overall vitality. But what if I told you that, taken in excess, particularly at night, vitamin D could be quietly increasing the risk of a devastating stroke? Here is how. Vitamin D enhances your body's ability to absorb calcium from food. In moderation, this process supports healthy bones and teeth. The trouble begins when older men and women pop high-dose vitamin D pills before bedtime. Their blood calcium levels spike unnaturally during hours when the body expects rest, not nutrient overload. Over time, this excess calcium can deposit in blood vessels and soft tissues, hardening arteries and choking off blood flow. Picture your arteries narrowing like plumbing pipes clogging over months of unattended scale buildup. The outcome is a significantly elevated risk of ischemic stroke that often goes undetected until the damage is done. As we age, our liver and kidneys become less efficient at metabolizing and clearing excess vitamin D. A dose that might be harmless for a young adult becomes dangerous for someone over 60. Shockingly, many over-the-counter vitamin D supplements provide 2, 3, or even 5 times the recommended upper limit of 2,000 international units per day. Daily megadoses are common. Retail shelves overflow with capsules labeled as high potency, but no one warns seniors about the dangers of nighttime dosing. Early warning signs such as fatigue, nausea, confusion, and irregular heartbeat often get dismissed as normal aging. Primary care physicians might attribute these symptoms to stress or early dementia. Rarely do they suspect vitamin D toxicity until a patient suffers a transient ischemic attack or full stroke. By then, the arteries have hardened, and the risk of permanent impairment or death is alarmingly high. Medical guidelines stress the importance of monitoring blood levels of vitamin D at least twice per year for anyone over 60. Sunlight exposure, dietary sources such as fatty fish, fortified dairy, and moderate supplementation under professional supervision can maintain safe levels without the need for massive doses. Getting nutrients from food rather than pills creates a more balanced intake and lowers the likelihood of sudden spikes in bloodstream calcium. The vitamin D crisis is a wake-up call. What seemed like a harmless health habit in your bedroom could be a ticking time bomb in your arteries. Next, let us examine another common supplement that packs a secret threat. Vitamin E. Vitamin E enjoys a reputation as a powerful antioxidant that prevents heart disease, slows aging, and supports cognitive function. Health influencers praise it for neutralizing free radicals. Yet in high doses, vitamin E functions as a potent blood thinner. Again, the very property that some see as a benefit can become a fatal flaw, especially when combined with prescription blood thinners. Clinical studies focusing on older adults reveal that daily intake of more than 400 international units of vitamin E nearly doubles the risk of hemorrhagic stroke, where a blood vessel in the brain ruptures and bleeds into surrounding tissue. Seniors often take daily aspirin or anticoagulants like warfarin or newer agents to prevent clots. Adding vitamin E pills on top of these medications can create a synergistic effect, thinning the blood beyond safe levels. A minor bump on the head in the shower or a trip on the stairs can trigger uncontrollable bleeding within the skull. Often, the earliest hints appear in subtle ways. Unexpected bruises may mar the skin. Nosebleeds last longer than usual. Blood in the urine can emerge. Most patients and even their doctors fail to connect these signs to vitamin E. The result is that the first major incident becomes a life-threatening emergency requiring rapid surgical intervention that can leave survivors with lasting disabilities. Registered dietitians advise obtaining vitamin E through natural food sources such as almonds, sunflower seeds, spinach, and avocado. These whole food options supply vitamin E alongside complementary nutrients in balanced amounts that the body can manage safely. For those on prescribed blood thinners, any supplemental vitamin E above normal dietary levels must be coordinated with a physician and monitored with regular blood tests to measure clotting time. As we peel back the layers on these nutritional myths, we cannot ignore vitamin B6. Known for its role in energy metabolism and nerve function, B6 toxicity delivers a devastating blow in the form of permanent nerve damage. Vitamin B6 supports the creation of neurotransmitters, helps metabolize proteins, and creates red blood cells. But high doses, often above 100 milligrams daily, accumulate in nerve cell bodies. The outcome is sensory neuropathy characterized by tingling, numbness, balance issues, and muscle weakness in the hands and feet. Several documented cases involve seniors self-medicating with large B6 tablets, believing they are boosting energy or improving sleep. Instead, they developed tingling so severe that walking became a challenge. Fine motor skills vanished. Holding a coffee mug or typing on a keyboard became feats of determination. Nerve conduction studies found marked declines in sensory nerve function. Sadly, even after discontinuing the supplement, many patients faced permanent deficits. Once nerve fibers sustained damage, regrowth is slow and often incomplete. The common misconception is that water-soluble vitamins flush out harmlessly in urine. In reality, excess B6 binds to receptors in the nervous system where it can remain and wreak havoc long after the pill has been flushed from other tissues. Medical experts urge getting B6 through a varied diet, including bananas, chickpeas, salmon, and fortified whole grains. If supplementation is necessary under medical guidance, doses should never exceed 20 milligrams a day for adults, and seniors should report early symptoms of neuropathy immediately. Next in our unsettling lineup is vitamin A, a fat-soluble nutrient celebrated for preserving vision and supporting immune health. Once absorbed, vitamin A stores in the liver and fatty tissues. Unlike water-soluble vitamins, it does not exit the body readily. Too much vitamin A triggers hypervitaminosis, raising intracranial pressure and mimicking stroke symptoms. Patients experience morning headaches, nausea, vomiting, blurred vision, and sometimes even seizures. Many rely on pills containing retinol palmitate or retinol, forms of preformed vitamin A. Nobody warns them that these compounds can accumulate to toxic levels over months of supplementation. Older adults whose liver function has declined face an even higher risk. Eye examinations may uncover optic disc swelling, but unless the physician takes a detailed supplement history, the true culprit remains hidden. Misdiagnosis often leads to unnecessary MRIs, invasive spinal taps, and delays in the only effective intervention, halting high-dose vitamin A supplements. A safer approach is consuming provitamin A carotenoids, abundant in carrots, sweet potatoes, and leafy greens. The body converts these plant-based nutrients to vitamin A as needed, preventing toxic buildup. Nutritionists stress that whole foods supply a spectrum of antioxidants and fibers that work together to regulate absorption and minimize harm. If all that does not keep you on your toes, consider niacin, also known as vitamin B3. It is known for its ability to improve cholesterol profiles by raising HDL levels and lowering LDL. But high-dose niacin constricts blood vessels and spikes blood pressure, ironically elevating the risk of stroke in older adults whose arteries have lost elasticity over time. Niacin flush, the red blotchy skin reaction some experience after taking large doses, is a warning sign that blood vessels are contracting. In young individuals with healthy vasculature, this may be a mild annoyance. In seniors with rigid arteries, the sudden narrowing causes dangerous pressure spikes. Clinical trials show a higher incidence of hemorrhagic strokes among participants who took more than 500 milligrams of niacin daily compared with those who relied on dietary sources such as peanuts, mushrooms, and poultry, or took physician-prescribed extended-release forms under close monitoring. Finally, we arrive at the stark reality. Older men and women process supplements in a fundamentally different way than younger people. Aging slows metabolic enzymes, alters body fat composition where fat-soluble vitamins accumulate more readily, and changes kidney filtration rates. In a single morning, a senior might swallow multiple pills: vitamin D for bones, vitamin E for heart health, B-complex for energy, fish oil for inflammation, unaware that each interacts with prescription medications they take for chronic conditions like hypertension or diabetes. A recent survey found that 80% of supplements on store shelves exceed the daily needs of most older adults, with doses far above recommended upper limits. Symptoms of toxicity: fatigue, cognitive decline, gastrointestinal distress, sensory disturbances, often mimic normal aging. Family members and healthcare providers presume it is time to adjust medications or accept the decline as inevitable. Usually, the cause remains hidden until a catastrophic event. A major stroke, a fall triggering a brain bleed, or sudden neuropathy demands urgent attention. The science is clear. When supplements and medications coexist, the risk of adverse interactions rises dramatically. Blood thinners plus vitamin E equals fatal hemorrhage potential. Niacin plus blood pressure meds equals dangerously low vascular resilience. Vitamin D plus calcium contamination equals hardening arteries and heightened cerebrovascular event probability. We are playing nutritional Russian roulette. So, what is the safest path forward? Whole foods. Leafy green vegetables, fatty fish, berries, nuts, seeds, legumes. These natural sources provide a balanced spectrum of nutrients in ratios our bodies evolved to handle. Food-based vitamins come packaged with cofactors, other vitamins, minerals, fibers, that regulate their absorption and minimize the peaks and troughs that lead to toxicity. If you or someone you love feel compelled to supplement, consult a doctor first. Especially if you are over 60 or taking medications, have blood levels tested regularly. Read labels carefully and avoid pills that list doses exceeding the recommended daily allowance by multiples. Remember, common vitamins can cause strokes or nerve damage when misused at high doses. This is not an argument against vitamins, but a call for caution. The road to better health is paved with knowledge, not blind faith in unregulated supplements. Nature's pharmacy is diverse and balanced if we choose it over the lure of a single pill promising miraculous benefit. In a final twist, the supplement industry operates with minimal oversight compared with prescription drugs. A pill label can claim any potency, and nobody double-checks unless someone suffers the consequences. A lack of regulation leaves seniors as unwitting test subjects in a high-stakes gamble with their health. If you found this report eye-opening, do not keep it to yourself. Share it with loved ones, especially those who think they cannot live without their nightly vitamin routine. A single conversation may prevent a medical catastrophe. To stay informed about hidden risks and health truths, subscribe to our channel. We dissect the science, strip away the hype, and give you the knowledge to make safe, informed choices. Hit the notification bell so you never miss a critical update. Because when it comes to your health, ignorance is not bliss. It can be deadly. Let us choose wisdom over wishful thinking, balanced nutrition over dangerous megadoses, and professional guidance over supermarket shelves. Your life may depend on it.